Production. My name is Ayush. I'll be your host tonight, and I'm one of the co-founding members of a firm called Yellow Squash. अभी Yellow Squash क्या चीज है वो भी मैं आप लोगों को बता दूं. Yellow Squash is nothing but a platform which is trying to help you solve certain problems. If you are into chronic conditions like PCOS, thyroid, weight, infertility के challenges, menstrual issues, there are endometriosis होता है लोगों को, fallopian tube के issues होते हैं, and so on. So those kind of issues, you have gone to Ayurveda, you have gone to homeopath, you have gone to allopathic. Obviously, you have tried 10, 20 different kinds of diet, and you have not been able to find a solution. तो वो सोल्यूशन आपको क्यों नहीं मिल रहा था और क्यों मिल पाएगा आगे अगर सही हम कदम बढ़ाएंगे तो all of that is what we are going to discuss in this session. So this session is important, and this session I hope everyone, I want people to respond also. Kindly share the link of Facebook Live. So we'll be sharing shortly. Hold on a second. Let me do that first. Allow me a second here, please. All right. I think my whole screen is shared. Okay. So we will be talking about FB Live link. All right. Okay. So there are several myths that we are facing. बहुत सारे myth हैं हमारे साथ में. इन myth को समझते हैं. And I want you guys to respond, and I want you guys to be active in the chat. I want you guys to tell me whether you relate to this. It is normal, ये आप लोगों को कई बार बोला गया होगा. It is normal to have painful experience while you are going through your cycles, whether you are in adolescent age, or whether you are a grown up, or whether you are close to your menopause, etc. The cycles have not been very easy. Painful cramps, mood swings, acne, वगैरह वगैरह हजार तरह के आप लोगों को problems रहे हैं. How many of you have been told that this is normal, this is something you would live with, you would have to live with? This is how it is. सारे लोगों का अलग अलग रहता है. किसी को ये प्रॉब्लम्स होती हैं, किसी को ये प्रॉब्लम्स नहीं होती हैं. आपको हो रही है तो आपको रहना पड़ेगा, इसे एक्सेप्ट करना पड़ेगा. 4, 5, 6 लोगों ने रिस्पॉन्ड किया है बस. बाकी सबको इस तरह के कोई इश्यूज नहीं फेस हुए कभी भी. प्लीज डू रिस्पॉन्ड, राइट? So these things are common, but they are definitely not normal. There are reasons why you're facing these issues, and there are methods which will help you come out of these feelings or these experiences. ये जरूरी नहीं है कि आप ऐसा फील करें. अगर इन प्रॉब्लम से, इन इश्यूज से बाहर आना चाहते हैं, अपनी बच्चियों को बाहर निकालना चाहते हैं, then you must listen into the rest of it. And if you are there for your daughter, then please make sure that your daughter also joins into this session. The second problem, or the second myth, which is fairly common, if you are having PCOS, a lot of people are advised to take hormonal pills. How many of you have been advised hormonal pills for PCOS? 3 लोगों को, 4 लोगों को. हरमन, नव्या, मानसविनी, हेमा, nobody else, Shruti. So 5 people are listening to the session. Session बंद कर दें क्या? सबको कॉल करके बात कर लेंगे 5 लोग. Consulting homeopathy, yes, good, right. So there are a lot of people who relate to this. Drugs can give you symptomatic relief. They definitely can. But there are again reasons why you're going, which is why this methodology of functional medicine is such a beautiful methodology which can help you, gives you the tools and assets and methodologies to identify the root cause. ये प्रॉब्लम है क्यों आपके साथ में, और उस प्रॉब्लम्स को रिजॉल्व करने के नेचुरल होलिस्टिक तरीके क्या हो सकते हैं. देन योर पीरियड्स आर सेपरेट फ्रॉम द रेस्ट ऑफ द बॉडी. बॉडी में कुछ भी चल रहा होगा, पीरियड का अगर इशू हो रहा है किसी को, तो वो अलग है और आपकी बॉडी अलग है. आपको फिर भी उतनी मेहनत, उतना काम, उतना सब कुछ करना चाहिए जितना आपको रेगुलरली. हाउ मेनी ऑफ यू हैव फेस्ड अ डिलेमा लाइक दिस? This is the expectation of the entire world. Please type in yes or no. Right. So these are the things that we are trying to answer. We are trying to understand how hormones work and how it is overall at an overall level influencing your health. Now, this is extremely important. The kind of problems that you have been defined or defined with, rather, or have been told to you, are the things that you can see as leaves of this tree. आप ऊपर का हिस्सा देख रहे हो, क्रॉनिक फटीग, थायराइड डिसऑर्डर ना, थायराइड के बारे में सब क्लिनिकल थायराइड, थायराइड जो आपका टेस्ट करने पे नॉर्मल आता हो बट सारे सिम्टम्स आपको रहते हैं, वो भी बहुत इंपॉर्टेंट. वी विल टॉक अ लॉट अबाउट सब क्लिनिकल थायराइड आल्सो, व्हिच इज वन such a huge issue with female across the world, not just India, everywhere. IBS, बहुत सारे लोगों, कितने लोगों को IBS की शिकायत बताई गई है? Is there anybody who is an IBS patient? Yes or no, people? Anxiety, depression, autoimmune also we'll be discussing. Autoimmune is a central part of this entire hormonal imbalance. Ashu will be speaking about that. Right? So all of the issues, PCOS, PCOD, weight, psoriasis, etc., they emanate from the root causes, and those root causes are identified below. Anxiety रहती है बहुत लोगों में. Anxiety, how many of you are aware of anxiety is a factor or could be a factor, a huge factor because of thyroid imbalance? Were you, yes or no, were you aware of this? So we will talk about, many people were aware, this is beautiful. Digestive disorder, yes, that also is there. So poor diet, stress, leaky gut. Leaky gut, many of you might have heard of leaky gut. Is this somebody who has heard of leaky gut? Hypothyroidism. Sangeeta Bafna ji, आपसे तो पहले भी बात हुई है. Please bring your daughter. So please bring your, make your daughter attend this also, at least briefly. Right? Constipation, Rajesh Mohan ji, again, same issue. It's all how our gut microbiome, our digestive system, and interconnected होके the entire hormones, enzymes, the entire soup is working. Sunlight का रोल क्या रहता है, GMOs का रोल क्या रहता है, water quality का रोल क्या रहता है, EMF radiation क्या क्या, all of these factors जो पहले नहीं थे. The reason why your mothers or grandmothers or great grandmothers were not suffering from all of these situations is that our environmental conditions have changed, and all of the factors that we have mentioned below at the root causes, and that is why we are having new diseases. उसी वजह से नई बीमारियां आ रही हैं. Mood swing also is a factor of thyroid. So we'll talk about all of this. Now, in order to speak more about all of these things, I would like to introduce Dr. Ruhi and Mr. Siddharth Goel. They have been doing considerable amount of work in functional medicine space. Both of these lovely people, they have been associated with, deeply associated with female health concerns. Hair fall again is a factor of thyroid. वो भी आपको देखना होगा. So Dr. Ruhi is an allopathic doctor. She is an MBBS. She is MSc Global Health. But most importantly, she has devoted a sizable amount of her time and work and energies towards female centric health. So she has been working with PCOS, PCOD, weight issues, infertility, and so on. All of these issues for a fairly long period now, with beautiful results. Also autoimmune thyroid. So we Hashimoto's, yes. Graves, yes. All of these things are also. Sejal, yeah, you have attended in the past also, I suppose. So yes, this is autoimmune. के बारे में ये कहना मैं चाहूंगा, the only methodology that we know can cure autoimmune conditions in many cases is a functional medicine approach. So Mr. Siddharth Goel, last but not the least, of course, Mr. Siddharth Goel is a yogi. He is a Hatha yoga expert. He is also a functional medicine coach. He has devoted a lot of time towards psychosomatic conditions and issues. So all the mental issues, all the calmness related issues, psychosomatic issues, ये सारी चीजों के ऊपर ये बहुत समय से काफी सारा काम कर रहे हैं. So we are very proud to bring out these lovely people in this beautiful program. Happy hormones to you guys. And tingling, Uma ji, tingling ke type 1 diabetes is a very specific and a typical approach. We'll talk about that also separately. But then this is more about female hormones and female health and so on and so forth. but we can talk about that as well. So without further delay, I would like to welcome Dr. Ruhi to speak more about how these different conditions affect us and what we can do to overcome. Over to you, ma'am.
Thanks, Ayush. Namaste, everyone. Thank you for being with us today. I'm excited to share more about how we can work on the root cause and help most of the women here who are here for hormonal imbalance. My transition from allopathic medicine to functional medicine has been my own journey of hormonal imbalance, finding answers to how to correct the condition. So I can very well relate to all of you here who are struggling with hormonal imbalances, the struggle, the various symptoms, the mood swings, and you name it. So having gone through this myself and able to reverse it, so now I'm looking forward. I've been working with a lot of other women, helping them reverse their condition. And this group program was started with the thought, with the intention to help a lot larger women out there who are struggling with this on a day-to-day basis. And when you work on this, when you work together as a community, you learn from each other, you feel empowered, and that's how you're able to bring a larger change in yourself and in the people around us. So this is what brings me and Siddharth together to help women reset their hormones. Siddharth, please join.
Thank you, Dr. Ruhi. So namaste, good evening to everyone. It's wonderful to be speaking to all of you lovely people. So how we started this program was, so both Dr. Ruhi and myself, we had been consulting with people on a one-to-one basis. और इस प्रोसेस में जब हम लोगों के साथ काम कर रहे थे तो we became aware कि बहुत common है ये problems, right? PCOS, PCOD, fibroids, infertility, thyroid issues, diabetes, obesity, acne, hair fall, ये एकदम rampant है हमारी society में, especially for women. And what was very painful was to see कि कोई भी proper solution नहीं मिलता. आप बस डॉक्टर से एक डॉक्टर दूसरे डॉक्टर जाते रहते हो हर 6 महीने साल भर में चेंज करके, लेकिन प्रॉब्लम में कोई फर्क नहीं आता क्योंकि उसका जो रूट कॉज है उस पर कोई ध्यान नहीं दे रहा है. सो ये बेसिक था हमारा आइडिया कि इतने लोग इससे सफर कर रहे हैं और अगर हम वी कैन रीच आउट टू मोर पीपल in a group program which has a lot of benefits, lot of synergies are there in a group program. बहुत इजी हो जाता है ये काम करना, ये चेंज करना, मतलब अपनी हेल्थ के ऊपर काम करना जब आप एक ग्रुप में सब मिलके साथ काम करते हैं. So that was the beginning of the thought process कि let us do a program. And so right now आप लोग जो इस प्रोग्राम में आए हैं, किसी को थोड़ी एक दो प्रॉब्लम है, किसी को बहुत सारी प्रॉब्लम्स हैं, राइट? वजन बढ़ा हुआ है, बॉडी में एनर्जी की कमी रहती है, चिड़चिड़ापन, मूड स्विंग्स, इरिटेशन, एंगर, सारे जिससे घर का एटमॉस्फेयर बिगड़ता है, राइट? What we want to offer in this program is a possibility कि अगर आप अपने लाइफ में थोड़े से चेंजेस कर सकते हैं, आप ये सारी प्रॉब्लम से फ्री हो सकते हैं. ओके, यू कैन लूज वेट, यू कैन गेन एनर्जी वाइल लूजिंग वेट. ओके, वेट लॉस करने के लिए ये जरूरी नहीं है कि आपका एनर्जी भी कम हो जाए. आपका दिमाग शांत रहेगा, आप खुश रहेंगे, आपको गुस्सा नहीं आएगा, चिड़चिड़ाहट नहीं होगी, स्किन साफ हो जाएगी, बाल झड़ने बंद हो जाएंगे, पीरियड्स तो डेफिनेटली रेगुलर हो जाएंगे, डेफिनेटली. इनफैक्ट हमने हमारे पुराने पार्टिसिपेंट्स हैं जिनको फाइब्रॉइड्स थे, जिनको बोला गया कि सर्जरी के अलावा कोई ऑप्शन नहीं है, पीपल हैव रिकवर्ड कंप्लीटली. सो ऑल दिस इज पॉसिबल इन दिस प्रोग्राम. सो आर यू इंटरेस्टेड? डज इट मेक सेंस टू यू? I want to hear some replies, or you can say yes in chat. Wonderful.
And I'm sure at least all of you would be able to connect with one of the myths that Ayush had shared, right? That if you are suffering with the pain or mood swings, you have to live with it. One of them, right? At least आप लोगों ने भी एक ना एक वो myth सुना होगा, and you might be still living with it. So to start with, let's understand that periods or irregular periods, all these, it's not just about fertility, right? हमें बोला let's say any woman is struggling with irregular periods, most of the time it's said that don't worry about it, when you want to have, when you want to start a family, we will fix this, we will work on it, right? तो आप 30 years के 28 या 30 years के age तक wait करोगे, and then during all that time you are still living with all those imbalances, all the struggles which is resulting because of those imbalances, right? So periods or anything, or the hormonal imbalances, it affects a woman on a day-to-day basis. It affects the way you think. It affects your productivity at work. It affects your mood, your emotions. So it's much more than just about reproduction. So we need to come out of that mindset that it's all about fertility. Hormonal imbalance tab fix karenge jab you want to have a child. We need to come out of this mindset. Let me change my screen. Sorry. So here we see this entire puzzle with a whole lot of symptoms. How many of you can connect with these symptoms? How many of you have at least 4 or 5 of these symptoms?
You can actually put the number in the chat कि कितने हैं, 2 हैं, 3 हैं, 4 है, वो नंबर आप चैट में डाल दें.
How many of you have 5 of these symptoms? Heavy periods, breast pain, acne, facial puffiness, bloating hair, you get angry very quickly. Hair loss is like routine. You feel tired all the times. You almost feel like you're getting into depression. So I see some of them have 9 of them, 5, more than 7. So most of you have written it's more than 5. And let me tell you, these are all related to hormonal imbalance. Agar aap constipated ho, it is connected with your hormones. If you're having headaches, it is connected with your hormones. So all these symptoms, so now can you imagine if you have even 5 of these, how much of your life is being impacted on a day-to-day basis? How can we have only one pill fix all these symptoms of hormonal imbalance? Agar PCOS hai, how can just a birth control pill solve all these symptoms related to PCOS? It definitely cannot fix it. Agar aapko thyroid ki problem hai, how can just a thyroid pill fix this, your symptom of night sweats, your symptom of constipation, tiredness, everything? It's just not possible. It is like, you're just trying to convince yourself about something and it's never going to happen. So we really need to change the way we are looking at things, change the way we are treating things, right? We cannot continue to, of course, it's not just possible to treat each symptom because there are so many symptoms connected to hormonal imbalance. So if we have to treat them, we have to look at why in the first place you have these problems. क्यों आई है ये सारी problem? क्यों आपको constipation हो रहा है? क्यों आपको mood swings हो रहे हैं? We need to dig further into it and find the root cause, fix the root cause. All these problems आपने acquire किया है during your lifetime. You are not born with it. You are not born with PCOS. You are not born with a thyroid condition. You are not born with a fibroid. You have all acquired it during lifetime, and anything which you have acquired during lifetime is because of the environment you have given your body, the kind of food you have fed your body, the kind of stress situations you have given to your body. And when you work on all these things, you will be able to reverse all these problems. So around 30% of you in the poll said that you are here for PCOS. 30% of you are here for thyroid conditions. Around 25-30% of you are here with diabetes. So now, if you're all these conditions, the solution is not to take the pill. That's just not the solution. You need to work on the root cause if you really want to come out of this diseased situation. So let's see how can we do that. There are 5 main causes when it comes to chronic conditions, especially like hormonal imbalance. The first is what you feed your body. So a poor nutrition diet. So basically अगर आप खाने में ज़्यादा refined carbs खा रहे हैं, processed sugar high है, refined oils and all the hydrogenated vegetable oils, आपके diet में ये सारी चीजें अगर ज़्यादा है, antioxidants कम है, you are not taking enough fruits, enough raw veggies, basically your diet is kind of devoid of any nutrition. आप पेट भरने के लिए खा रहे हो, not to really make your body functional. And such a diet which is rich in refined carbs, refined food, it is one of the root cause of hormonal imbalance. Later हम बात करेंगे insulin resistance के बारे में. So this is one cause. Poor nutrition is one major cause of hormonal imbalance. Second, the kind of environment you're living in, right? Now, अगर आप ज़्यादा toxins है आपकी body में, right? This toxins can be coming from water, it can be coming from pesticides, और जब ये सारी चीजें, या आप बहुत सारे medicines ले रहे हो, right? So all these increases the workload of the liver. हमारे जो भी hormones है, estrogen for example, estrogen is made in the body and then it also has to be eliminated from the body. लेकिन अगर आपका liver और चीजों में ही busy हो रखा है, या liver is not functioning well, it will not be able to eliminate the estrogen from the body. चलिए liver ने काम कर लिया, लेकिन stomach healthy नहीं है, your stomach, you have got chronic constipation, या आपके gut microbiome healthy नहीं है, leaky gut है. So all these again, the estrogen metabolites are again not eliminated from the body, वो body में ही रहते हैं, leading to estrogen dominance, right? So poor detoxification is again another major cause of hormonal imbalance, a contributor to hormonal imbalance. So if your gut is unhealthy, it is a trigger point for hormonal imbalance. Toxin loads, हम आज a lot of toxins, you know, and a lot of these are similar to hormones. We call them hormone mimicking toxins. So and they are endocrine disruptors, जैसे heavy metals हो गए, pesticides वगैरह में है जितने, sunscreen lotions में काफी होते हैं, personal care products, home cleaning products, plastics have BPA, which again are endocrine disruptors. Meat, for example, meat today is fed with a lot of hormones. Animals are fed with a lot of hormones. Cows are fed with a lot of hormones to make more milk, to produce more meat, right? All these, when we consume them, it goes into our body and messes up our hormones. So all these endocrine disruptors are, they damage our receptors, the endocrine receptors where the hormones have to work, they block them. So that's another major cause of hormone imbalance. Chronic stress, again, we do not realize it, but it impacts our health in big way. Well, Sakshi says I'm not loud. Am I audible to others? Okay. So chronic stress is one major reason. So basically what it does, it will completely shut down your thyroid function. It will completely shut down your reproductive system, because when the body is in a state of stress, for the body, it's more important to counter that stress in which you are in, rather than, you know, reproduction pe dhyan de ya metabolism pe dhyan de. So one is emotional stress. So if you have been constantly emotionally stressed or mentally stressed, you need to come out of it if you want to fix your hormones. The second is physical stress. When I talk about physical stress, I'm referring to food sensitivity. अगर आप gluten intolerant हो, lactose intolerant हो, या बाकी कुछ food allergens है जो आपको कुछ तरह के food है जो आपको suit नहीं करते, it's very important that you identify those triggers and avoid them, because if you don't do that, they are causing inflammation in your body in a chronic way, and this over a period of time damages your gut, and again, you know, leads to systemic inflammation. And the last and the most important is the nature disconnect. जितना हम nature से दूर जा रहे हैं, उतने ही हम health problems को बुला रहे हैं. So if we are not connected with nature, if we are not connected to sun, we are not connected to ground, if we are a lot exposed to artificial radiations, all the whether it's coming from the phones or the microwaves or other gadgets around us, all these are damaging our body. So we need to optimize what we are exposed to, and at the same time connect more with nature so that we can really minimize the impact that all these artificial radiation is happening on us. So all these 5 main causes, what do you think? Can they be reversed? Is this something which we cannot do anything about? How many of you think that these 5 factors can be reversed? Can we change our food? Can we improve our detoxification? Can we reduce the toxins? Can we work on our stress levels? Can we go out in the sun? Can we connect more with Mother Nature? So yes, a lot of you are saying we can reverse it, right? So all these are in our hands. We need to know how to implement it in a sustainable way so that we can implement it and live a healthier life. So let's understand more in detail, how does bad food impact our body? How does that cause hormonal imbalance? So insulin is one hormone which is produced by the pancreas. उसका काम होता है ब्लड शुगर को मैनेज करना. तो जब हमारा खाना, अगर हम ज्यादा रिफाइंड कार्ब्स खाते हैं, हम एक्सरसाइज नहीं कर रहे हैं, हमारे बॉडी में टॉक्सिन्स बहुत ज्यादा है और हम क्रॉनिकली स्ट्रेस में हैं, सो ऑल दीज आर कंट्रीब्यूटिंग फैक्टर्स. सो जब हम रिफाइंड कार्ब्स खा रहे हैं, of course refined carbohydrates immediately gets converted into glucose, and this glucose needs insulin ताकि ये glucose cells के अंदर भेजा जा सके and बाद में it can be utilized to make energy. So अगर आप ज्यादा refined carbs खा रहे हो, ज्यादा glucose में convert होगा और ज्यादा insulin चाहिएगा. So अगर तीनों टाइम आप अगर wheat की रोटी खा रहे हो या you're having a lot of white rice, आप बीच में snacks भी खा रहे हो, so all these, it's like you are constantly telling insulin, please help the glucose go into the cells. आप constantly bother कर रहे हो insulin को, and एक point आएगा जब insulin will also say I'm done with it, I cannot handle anymore. And this is what happens in case of insulin resistance. So constantly we keep bothering insulin, we keep eating refined foods, we are not moving, and we are chronically stressed. So all these eventually lead to more insulin. Insulin ज़्यादा secrete भी हो रहा है लेकिन वो काम नहीं कर पा रहा है, which means it's not able to push the glucose into the cells. As a result, क्या हो रहा है? Glucose is high in the body, is high in the blood, and now when the glucose is high, it has to go somewhere. So what happens is it starts getting converted into fat, and this is the fat that you see on your belly, the belly fat which you're not able to lose. Now glucose has got converted into fat, but the cells are still starving. They are hungry. You have just eaten a whole heavy meal with white rice, with maybe some dal, thodi sabzi, but you're still starving. Why? Because of insulin resistance. So your cells are starving, and this makes you feel hungry, and eventually you end up eating more sugar. You end up grabbing a pack of biscuits or a pack of chips, and you name it, basically binge eating. So this vicious circle keeps going on, and this is what leads to all the other after effects of insulin resistance. So high insulin levels के कारण glucose ज़्यादा हुआ, glucose के कारण fat ज़्यादा deposit हुआ, and it makes you put on a lot of weight. And this weight is difficult to lose. It's the one you have on your belly. It's the one you have on your face, the one you have on your back. And more fat cells means more conversion into estrogen. So, and this estrogen, when it remains high for a long time, that's called estrogen dominance. I am constantly getting messages here. You're not able to hear me. Ayush, are you able to hear me? Ayush, Siddharth?
Yes. They might not have connected to the mic,
Okay.
to the audio.
Okay. So अगर आप मुझे नहीं सुन पा रहे हो, please connect to the audio. There's an option at the bottom. Connect over audio.
माइक का सिंबल बना हुआ है, उस पर क्लिक कर दीजिए, या फिर you can also go to Facebook Live.
Yes. All right. So more fat cells means more estrogen. So basically आपके body में भी ज़्यादा estrogen float करने लगता है, and क्योंकि fat में ज़्यादा conversion हुआ है, so this fat starts depositing on your body. It starts depositing on your liver as well. and it's leading to fatty liver. आपने कभी अल्कोहल नहीं लिया होगा लाइफ में, लेकिन फिर भी आपके अल्ट्रासाउंड में आ रहा है fatty liver. So that is called non-alcoholic fatty liver, and it's commonly seen in many people today because the diet has been rich in refined carbs. It's not because of alcohol. Diabetes, again, the root cause is insulin resistance. So अगर आपको PCOS है, so you're very likely to develop diabetes. आपको अगर PCOS है, you are very likely to get thyroid condition and even more likely to get autoimmune thyroid condition. And of course, your lipid profile will go haywire क्योंकि ज़्यादा triglycerides बन रहे हैं body में. Okay, so all these are interconnected. Again, high insulin levels means more conversion to androgens. Androgens are the male hormones. Females में होते हैं androgens, but they are in a balanced quantity, balanced levels. So when your insulins are high, it gets converted into more male hormones, and these male hormones are giving you acne. They're giving you facial hair. It's causing hair loss, right? Now, can you understand where are all the symptoms of PCOS coming from? It's all coming from high insulin. So someone has asked, estrogen, androgen are bad for us. Estrogen is not bad for us, but high estrogen is bad. That is what gives you the symptoms of breast pain, lumps, fibroids, PCOS. Androgens, again, they're required in a balanced level in case of female. Abha will come to PCOS. So insulin resistance is the root cause of PCOS. So high estrogen dominance means high estrogen. And this again is resulting from high insulin levels, right? Estrogen dominance के कारण ही आपको breast pain हो रहा है before the periods. If you're feeling breast tenderness, it's because of estrogen dominance, and that's not normal. Fibroids, PMS symptoms, heavy periods, painful periods, fibrocystic disease, again, it's very common in females. Breast lumps ho rahe, endometriosis, adenomyosis, cystic ovaries. These all are resulting from estrogen dominance. They are resulting from high insulin levels in the body. Yes, we can know if estrogen is high. Of course, there are lab work which can be done to know the estrogen. And much more important than the lab work is the fact that you have these symptoms. So coming to PCOS now, can you now understand the link between the root cause of insulin resistance, estrogen dominance, and the PCOS symptoms? Why are you having the high testosterone levels? Diabetes क्यों हो रहा है PCOS में आपको? आप tired क्यों feel कर रहे हो? Acne, mood changes, trouble conceiving. Of course, yes, because your hormones are estrogen and progesterone have to be in balance when you want the ovulation to happen. Unwanted hair growth. So all these are so interconnected, and these all boil down to one root cause, insulin resistance. And insulin resistance is coming from your lifestyle habits, your state of stress, the toxins you are taking into your body, and how much disconnected you are with what nature has provided us. So, but there's still more to what I've just spoken, and I'll have Siddharth to talk more about that. One, to dive deeper into one critical factor which impacts hormonal imbalance. So Navya is asking, hormone test is normal, but ovulation is not happening. So Navya, again, agar hormone test normal hai, again, in functional medicine, when we don't go by the lab ranges, the functional ranges are very narrow. Agar sab kuch normal hai, to ovulation bhi hona chahiye, right? So that means something is not okay, and this needs to be connected. Preeti, can you please suggest tips to control mood swings? Highly needed one in PCOS. So we'll come to that, Preeti. With tips nahi batayenge, we'll come more on how we work on the root causes. Over to you, Siddharth. You are not audible, Siddharth.
Sorry. थैंक यू. तो दैट वाज अ वंडरफुल सेशन. आपने बहुत ही ब्रीफ में बहुत सारी इंपॉर्टेंट चीजें समझा दी हैं ग्रुप को. आई होप एवरीबॉडी इज sitting up and listening carefully now, so you've made my job also easier. So what is this missing critical factor? Can anybody guess what is it that we are missing? Dr. Ruiz already covered so many things. She's actually spoken about this also, but very briefly. The topic is actually very, very important. Exercise. Okay, I think he already spoke about a little bit of that. Being in sync with nature. Being in sync with nature, means you are using your body always. Yoga, diet, healthy lifestyle. Okay, stress. Okay, breathing. Wonderful. Thank you. So some of you are hitting the nail on the head. See, we are talking about thyroid, right? Hypothyroid. जो शुरू में पोल हुआ था उसमें almost 1/3 of the people who participated said कि thyroid की problem है, right? Hypothyroid है, most of them. Please understand, the moment you have stress in your system, in your mind, the moment you have stress, the cortisol, the adrenaline levels will start going up. And the moment that happens, your thyroid hormone levels will start going down. Okay? I'm just using this as an example because almost 1 out of 3 people here are struggling with a thyroid problem, right? आपने बहुत कुछ किया, आपने दवाई खाई, आपने अपनी डाइट चेंज करी, बट आपने स्ट्रेस लेवल पे कुछ काम नहीं किया. आप थायराइड अपना ठीक कर पाओगे? Is it likely that it will improve? Very unlikely, isn't it? So just to give you a little bit of an example before we start off. So आज modern science जो है, so see, I actually cover both sides, right? I study functional medicine. I practice functional medicine, but I have also been studying yoga and meditation and pranayam for almost 18-19 years now. So I have the experience and understanding of both sides. So yoga has been saying for thousands of years that most chronic ailments are psychosomatic. That means the cause of the disease is mostly in the mind. Okay. Now today modern science is also saying the same thing. आज मॉडर्न साइंस भी यही कह रही है कि एक्चुअली ज्यादातर बीमारियां 80% या उससे भी ज्यादा बीमारियों की जो जड़ है वो आपके दिमाग में है, आपके टेंशन में है, आपके स्ट्रेस में है, आपके गुस्से में है, चिड़चिड़ाहट में है, आपके डिप्रेशन में है. ओके, आप में से कोई ऐसा है? ऐसा कोई नहीं. आप में से कितने लोग ऐसे हैं जो अपने आसपास कुछ ऐसे लोगों को जानते हैं जो एकदम मतलब क्रैप फूड खाते हैं, कचरा. ओके, they don't bother about what they're eating, but उसके बाद भी उनकी हेल्थ अच्छी रहती है. ऐसे लोगों को जानते हैं आप? एटलीस्ट 1-2 लोगों को. और आप बहुत ध्यान देना शुरू कर दिया है, कितनी सारी चीजें खानी बंद कर दी, कितनी सारी चीजें जो पसंद नहीं थी वो खाना शुरू कर दिया, बट फिर भी हेल्थ ठीक नहीं होती है पूरी. ऐसे हैं यहाँ पे कोई लोग? Yes, my husband. Now that is difficult. If your husband is like that, then you are in major trouble. Right? Yes, many people. There can, the main difference between them, eat like a dustbin. That is funny. Okay? तो मेन फर्क क्या है उनमें और हम में? एक बहुत बड़ा फर्क है कि वो जनरली मस्त मौला टाइप के लोग होते हैं. उन्हें टेंशन नहीं होता आसानी से किसी चीज का. ओके, जब वो टेंशन नहीं लेते तो उनका शरीर ठीक काम करता है. वो कचरा जो खाना खा रहे हैं ना, डस्टबिन की तरह, वो भी हैंडल कर लेता है शरीर. लेकिन आप अगर दिमाग में टेंशन रखते हैं, आप पुरानी बातों पे अभी भी परेशान होते हैं वगैरह वगैरह. और पुरानी बात मतलब सुबह कोई बात हुई तो वो भी पुरानी हो गई ना, शाम हो गई अब. तो पुरानी बातों पे अभी भी आप टेंशन में रहते हैं, तो मतलब आप यू आर क्रिएटिंग द डिजीज फॉर योरसेल्फ. वो बाहर से नहीं आ रही, हम पैदा कर रहे हैं उसको, राइट? So most chronic ailments are psychosomatic in nature. Modern science as well as ancient sciences are saying this. कैसे होता है? आपको पता है कि जरा सा भी टेंशन होते ही, स्ट्रेस लेवल बढ़ते ही स्ट्रेस हार्मोन्स बढ़ने लगते हैं. ये तो हमको सबको पता है, राइट? एड्रेनलिन, कॉर्टिसोल, सबका सिक्रीशन बढ़ जाता है. एक बात बताइए, जब आप स्ट्रेस में होते हैं, टेंशन में होते हैं, गुस्से में होते हैं, तो वही नेगेटिव थॉट्स घूमते हैं दिमाग में, राइट? यू कीप ऑन थिंकिंग अबाउट द सेम थिंग। कई बार आप कोशिश करके भी नहीं बंद कर सकते उन चीजों के बारे में सोचना। यस, ऐसा कभी अच्छी चीजों के साथ नहीं होता, राइट? समथिंग हैपेंड जिसकी वजह से आप बड़े खुश हो गए, कितनी देर सोचते हैं उसके बारे में? 10-20 मिनट, आधा घंटा, 1-2 घंटा, राइट? बट जो चीजें नेगेटिव हैं, जो नेगेटिव एक्सपीरियंस हैं, राइट, वो सालों पहले की बात भी अभी भी आपको याद आती रहती है और आप उसके बारे में सोचते हैं, और जब सोचते हैं तो आपकी हार्ट बीट बढ़ने लगती है, आपको अभी भी गुस्सा आने लगता है, फ्रस्ट्रेशन होने लगता है, राइट? उसने ऐसा क्यों कहा, उसने ऐसा क्यों किया मेरे साथ, वगैरह वगैरह। तो क्या हो रहा है? यू आर creating repetitive thoughts and repetitive emotions, and these repetitive thoughts and emotions are creating those hormonal patterns. और जब आपका दिमाग उसी तरह से चलता रहेगा तो धीरे धीरे आपकी बॉडी में भी वही हार्मोनल इम्बैलेंसेस का पैटर्न बन जाएगा, राइट? स्ट्रेस इज क्रिएटिंग दैट पैटर्न, योर माइंड, योर इमोशंस आर क्रिएटिंग दैट पैटर्न। और जब आपने अपने दिमाग से हार्मोन्स को इम्बैलेंस कर लिया तो हार्मोनल इम्बैलेंस की प्रॉब्लम्स आएंगी कि नहीं आएंगी? पीसीओएस होगा कि नहीं होगा? थायराइड का प्रॉब्लम आएगा कि नहीं आएगा? हेयर ग्रोथ होगा कि नहीं होगा, जो कि मतलब फीमेल्स में नहीं होना चाहिए, राइट? या मेल टाइप बॉल्डनेस की यहाँ से बाल झड़ने शुरू हो जाएंगे, ये सब होना ही है, राइट? इनफर्टिलिटी होगी, पीरियड्स मिस होंगे, बिकॉज वी हैव क्रिएटेड द हार्मोनल इम्बैलेंस। वो आसमान से नहीं टपकी हमारे पर प्रॉब्लम, हमने पैदा करी है इन आवर अनअवेयरनेस, क्योंकि हमने अपने शरीर और दिमाग को, अपने मन को ठीक से इस्तेमाल करना सीखा ही नहीं कभी, हमें सिखाया नहीं गया, राइट? ना घर पे सिखाया बचपन में बड़े होते में, ना स्कूल कॉलेज में सिखाया। दिस इज द प्रॉब्लम। इसके कुछ एग्जांपल्स नीचे वो व्हाइट वाले बॉक्स में आपके स्क्रीन पे हैं, राइट? किसी चीज से आप एकदम से डर जाते हैं बहुत जोर से, तो क्या होता है? पेट में अजीब सी फीलिंग होती है, राइट? बिकॉज योर ब्रेन एंड योर गट आर वेरी डायरेक्टली कनेक्टेड, दे आर इम्पैक्टिंग ईच अदर वेरी वेरी पावरफुली, राइट? आपको पता है कि आई एम श्योर आप ऐसे कुछ लोगों को जानते होंगे जो एक स्ट्रेसफुल पीरियड से गुजरे अपनी लाइफ में, और उस पीरियड में उनको अल्सर्स पैदा हो गए थे पेट में और इंटेस्टाइन्स में, राइट? टेंशन रहा बहुत ज्यादा, हार्ट की प्रॉब्लम हो गई कुछ समय बाद, राइट? आई एम श्योर आप ऐसे कुछ बच्चों को जानते हैं जो एग्जाम के समय सुबह उनको डायरिया हो जाता है, लूज मोशन हो जाता है। जस्ट इमेजिन, राइट, कि स्ट्रेस से पूरा का पूरा डाइजेस्टिव सिस्टम गोज हेवायर। नाउ इमेजिन कि ये स्ट्रेस आपकी चलती रहे, राइट? लो ग्रेड में भी, उतना स्ट्रेस, उतना ज्यादा नहीं कि आपको लूज मोशन हो जाए, बट इमेजिन दैट द स्ट्रेस गोज ऑन थ्रू आउट, राइट? व्हाट आर यू डूइंग? यू आर क्रिएटिंग अ डिजीज, यू आर क्रिएटिंग, आपने उसके बीज बोए हैं बीमारी के, आपने उसको पानी डाल के सींचा है, राइट? इन आवर अनअवेयरनेस वी आर डूइंग दैट। तो हाउ डज इट वर्क इन आवर सिस्टम? हमारे ब्रेन में ना जो नर्वस सिस्टम है उसके दो मेन पार्ट होते हैं ऑटोनोमिक नर्वस सिस्टम के, एक को सिंपैथेटिक बोलते हैं, एक को पैरासिम्पैथेटिक बोलते हैं, ठीक है? जब आप टेंशन में हैं, गुस्से में हैं, फ्रस्ट्रेशन में हैं, डिप्रेशन में हैं, स्ट्रेस में हैं, जेलसी में हैं, तो आपका ब्रेन का सिंपैथेटिक नर्वस सिस्टम वाला पार्ट एक्टिव है, वो डोमिनेंट है, ओके? इसको हम फाइट और फ्लाइट रिस्पॉन्स भी बोलते हैं। ये हार्ड वायर्ड है हमारे ब्रेन में, ओके? वायरिंग ही वैसी है, ये दोनों सिस्टम्स हार्ड वायर्ड है। ये कहाँ से आया? जब हम लाखों साल पहले हम जब जंगल में रहते थे, राइट, उस टाइम पर मेन रिस्क क्या होती थी? मेन रिस्क ये होती थी कि कोई जानवर आपको मार के खाना चाहता है, राइट? तो उससे बचने के लिए नेचर ने ये एबिलिटी हमारे ब्रेन में दी, क्योंकि जब सिंपैथेटिक सिस्टम ऑन होता है तो ब्रेन आपके शरीर को लड़ने के लिए तैयार करता है, जिससे कि आप उस जानवर से लड़ के बच सकें, अपनी जान बचा सकें, और या उससे आप भाग सकें। दोनों चीजों के लिए क्या चाहिए? बहुत इंटेंस फिजिकल एक्टिविटी चाहिए, राइट? शरीर को तैयार किया जा रहा है। उस समय क्या होता है? आपका ब्रेन एकदम एक चीज पे फोकस हो जाता है, बाकी चीजें भूल जाता है, राइट? जो भी रिस्क, जो भी डेंजर है, उस समय मेटाबॉलिक एक्टिविटीज चेंज होने लगती हैं बॉडी को इमरजेंसी के लिए प्रिपेयर करने के लिए, हेल्थ के लिए नहीं। उस समय आपका शरीर को इससे मतलब नहीं है, आपके ब्रेन को इससे मतलब नहीं है कि शरीर में कोई बीमारी थी वो ठीक हो रही है कि नहीं हो रही, राइट? बीमारी पैदा भी हो जाए तो इट डजंट मैटर, बिकॉज अभी क्या इंपॉर्टेंट है? लाइफ बचाना अपनी। तो सारा का सारा बॉडी का फोकस, सारा हार्मोनल बैलेंस सब उस तरफ शिफ्ट हो जाता है। अब प्रॉब्लम क्या है कि ये जो स्टेट है ना, ये जरूरी है, हम इसी स्टेट की वजह से It is only because of this state that we have been able to survive for millions of years in the jungle. प्रॉब्लम क्या है कि ये जो स्टेट है ये शॉर्ट ड्यूरेशन के लिए बनी है. हम इस स्टेट में शॉर्ट ड्यूरेशन के लिए जाते हैं, थोड़ी देर के लिए, 10-20 मिनट के लिए, आधे घंटे के लिए, तो ठीक है, कोई प्रॉब्लम नहीं है. प्रॉब्लम क्या है, आज हमारी लाइफ हमने ऐसी बना ली है कि हम हर समय स्ट्रेसफुल स्टेट में ही रहते हैं. इसका अपोजिट क्या है, पैरासिम्पैथेटिक पार्ट ऑफ द नर्वस सिस्टम. इसको रेस्ट और डाइजेस्ट भी बोला जाता है. रेस्ट एंड डाइजेस्ट फेज. और when the parasympathetic nervous system is dominant, your entire body, everything will focus on health and healing. You will feel relaxed, your mind will be relaxed, your digestion will be better, your constipation will go away. Okay, body will use the energy available for healing and repairing itself. तो आपकी हेल्थ अच्छी होगी, आपका इम्यून फंक्शन अच्छा होगा, आपका थायराइड फंक्शन अच्छा होगा. ये जो स्टेट है ये हमारी लॉन्ग टर्म स्टेट है, प्राइमरी स्टेट. हमें हर समय इसमें रहना है. कभी कभी उस स्टेट में चले गए कोई बात नहीं, लेकिन पूरे टाइम उस स्टेट में रहेंगे तो हम बीमारियां पैदा कर रहे हैं. कोई इससे बचा नहीं सकता हमको. सो वी हैव टू लर्न. अगर हम चाहते हैं कि हमारा शरीर ठीक हो और लॉन्ग टर्म में ठीक रहे, तो ये बहुत जरूरी है कि हम ये सीखें कि कैसे हम अपने सिस्टम को सिंपैथेटिक से पैरासिम्पैथेटिक मोड में लाएं और वहां पर रखें. इसके बिना लॉन्ग टर्म हीलिंग होना बहुत मुश्किल हो जाता है. राइट. तो मैंने जंगल में बोला कि भाई कोई जानवर आपको खाना चाहता है, तो जैसे शेर है, टाइगर है. राइट. प्रॉब्लम क्या है कि आज की जिंदगी में कोई शेर हमारे को नहीं खा रहा, कोई हमला नहीं कर रहा हमारे पर. राइट. वो बेचारे हमसे, हमारी वजह से मर रहे हैं, बंदे जू में, या फिर वी आर किलिंग देम. प्रॉब्लम क्या है कि जो हार्ड वायर्ड पार्ट है आपके नर्वस सिस्टम का, ये एक्चुअली, अगर आपका बॉस आपके ऊपर चिल्लाता है या घर पे आपकी मदर इन लॉ गुस्सा है, तो उससे जो स्ट्रेस होती है आपके दिमाग में पैदा, योर ब्रेन इज नॉट एबल टू डिस्टिंग्विश बिटवीन दिस एंड द टाइगर ट्राइंग टू किल यू. एनी काइंड ऑफ स्ट्रेस यू क्रिएट, एनी काइंड ऑफ स्ट्रेस इन योर माइंड, योर नर्वस सिस्टम, योर ब्रेन थिंक्स दैट योर लाइफ इज इन डेंजर, एंड इट स्टार्ट्स डूइंग एवरीथिंग इट कैन डू to enable the body to fight that animal. Right. ये समझना बहुत जरूरी है कि आपकी बॉडी, आपका नर्वस सिस्टम is not able to distinguish between a tiger and a stressful job or a stressful home. Doesn't matter, right? Whatever, any kind of stress. और जब स्ट्रेस, जब वो डिस्टिंग्विश नहीं कर पाता है इसमें, तो वो क्या करता है, वो हेल्थ और हीलिंग को किनारे रख देता है. तो भैया भाड़ में जाए, अभी जिंदगी बचानी है. राइट. अब आप कोशिश करते रहिए कंसीव करने की. राइट. कैसे होगा कंसेप्शन? बिकॉज योर बॉडी इज नॉट अलाउइंग, द बॉडी डज नॉट वांट टू कंसीव, बिकॉज राइट नाउ द बॉडीज फोकस इज ऑन सर्वाइवल, not on procreating, not on creating a baby. Right. Only when you are in a state where you are in a pleasant, joyful, relaxed state, then the body will think, okay, now it's time to create a baby because there is no risk to my life. अब हम हाइपोथायराइड की बात कर रहे थे बिकॉज आई थिंक सबसे ज्यादा लोगों ने बोला थायराइड का प्रॉब्लम है उस पोल में, या सेकंड हाईएस्ट था. क्या सिम्टम्स होते हैं? थकान, एनर्जी का कम होना, फटीग, कॉन्स्टिपेशन, डाइजेशन ना होना अच्छा सा, ब्लोटिंग रहना, पेट फूलना, कुछ भी खाना खाया पेट फूलने लगता है, स्किन का ड्राई होना, ब्रिटल होना, नेल्स वगैरह ब्रिटल हो जाना, बाल झड़ना, वजन बढ़ते जाना, कुछ भी आप कर लो कम नहीं होना वजन, और मूड बहुत लो रहता है, एंजाइटी, डिप्रेशन, ऑल ऑफ दीस थिंग्स, स्वेलिंग, पफीनेस इन द फेस. इसके रूट कॉजेस क्या हैं? ऑलरेडी मैंने आपको समझाया कि स्ट्रेस इज अ मेजर थिंग, बिकॉज द मोमेंट यू क्रिएट स्ट्रेस, cortisol levels go up. Cortisol and thyroid hormones are inversely related. When one goes up, the other goes down, always. Okay, so just with a little bit of stress, you are creating hypothyroidism for yourself. इसके अलावा हम खाना खाते हैं, कुछ भी हमें कुछ हमने ध्यान नहीं दिया उस पर, हमने समझा नहीं है कि एक बैलेंस्ड न्यूट्रिशन हम कैसे लें बॉडी को, जिसमें बॉडी को जो भी चाहिए वो मिले. तो डेफिशिएंसीज हैं. राइट. ज्यादातर लोग आज आप देखो B12 में डेफिशिएंसी है, सारे बी विटामिन में डेफिशिएंसी है, डी में डेफिशिएंसी है, आयरन नहीं है, मैग्नीशियम नहीं है, जिंक नहीं है, शरीर में कम है, सब कुछ. तो कैसे थायराइड ग्लैंड काम करेगी ठीक से? उसको रॉ मटेरियल चाहिए. राइट. थायराइड हार्मोन बनाने के लिए वो हम नहीं दे रहे. न्यूट्रिशनल डेफिशिएंसीज है, स्ट्रेस है, ऑटो इम्यून डिसऑर्डर. योर इम्यून सिस्टम, डॉक्टर रूही ने थोड़ा सा मैकेनिज्म बताया था आपको कि कैसे मिमिक करते हैं हार्मोन्स वो कुछ टॉक्सिक केमिकल्स, उसी तरह से इम्यून सिस्टम जब एक्टिवेट हो जाता है, ओवर एक्टिवेट, I'm sorry, it can actually start going and damaging your thyroid gland. It can start creating, killing the cells, which is known as Hashimoto's. I'm sorry, and also Graves' disease is also autoimmune, right? Both of these are, one is hypo, the other is hyper. इसके अलावा एक और है toxins. Certain kind of chemicals, if they're there in your body, for example, fluoride, जो हम टूथब्रश के थ्रू लेते हैं, हमें पता ही नहीं है, टूथपेस्ट के थ्रू, वो अगर शरीर में आएगा तो आपका थायराइड का जो ग्लैंड है वो हार्मोन को नहीं बना पाएगा। क्यों नहीं बना पाएगा? क्योंकि वहां पे उसको आयोडीन चाहिए था। आयोडीन की जगह क्या होता है? फ्लोरीन आके बैठ जाती है। फ्लोरीन आके बैठने से जो केमिकल बनता है वो थायराइड का हार्मोन नहीं है, वो काम नहीं करता फिर शरीर में, राइट? सो देयर आर सो मेनी रीजंस दैट आर देयर फॉर ईच ऑफ दीज थिंग्स। हमको समझना पड़ेगा डेफिशिएंसी कहाँ है हमारे न्यूट्रिशन में, स्ट्रेस कहाँ है, कहाँ से आ रही है, हम उसको कैसे हैंडल करना सीखें, टॉक्सिन्स कहाँ से आ रहे हैं, हैवी मेटल्स कहाँ से आ रहे हैं, ऑटोइम्यूनिटी क्यों है हमारे को, ये सब समझना जरूरी है। जिसको बिना समझे आप सिर्फ सोचें गोली खा लें और ठीक हो जाए, ऐसा नहीं होने वाला, राइट? और हमारा एक्सपीरियंस भी यही है।
and I'll just add in here, हम बहुत कॉमन है देखते हैं कि हमारे पेशेंट्स they have hypothyroid condition and they are taking the thyroid pill, but still उनके symptoms ही ठीक नहीं हो रहे हैं, symptoms सारे वैसे के वैसे ही हैं, क्योंकि अगेन एक पिल से हम लोग सोच रहे हैं कि it will make the thyroid start working, वो वैसा तो कर ही नहीं रहा। आप एक रेडीमेड चीज बॉडी को दे रहे हो जिसको अगेन काम करने के लिए एक एक्टिव फॉर्म में कन्वर्ट होना पड़ेगा, which again requires certain nutrition. It requires your body to be active as well. जो अगर आप नहीं फिक्स कर रहे हो, अगेन वो गोली भी बेकार है आपकी बॉडी के लिए। So again we are stressing on the point, कोई एक pill is not going to fix your problem. You need to work on the root cause.
करेक्ट। आपको सारे कनेक्शन समझने पड़ेंगे कि किस चीज से ये प्रॉब्लम होती है, किन किन चीजों से, और उन चीजों को सॉल्व करना शुरू करना पड़ेगा। If you do that, there is no way that you will not improve. ऐसा हो ही नहीं सकता कि आपकी हेल्थ इंप्रूव ना हो, right? So going ahead, अब हम infertility, so another very common complaint is today infertility। आप देखो हर मोहल्ले में आपको fertility clinics मिल जाएंगे जो आज से 20 साल 30 साल पहले नहीं होते थे, right? क्यों? Because इतने ज्यादा लोगों को प्रॉब्लम हो रही है fertility में, which again I think डॉक्टर रूही ने बोला पहले भी कि हमारी जो पहले की जनरेशन थी, हमारी मदर्स या हमारी ग्रैंड मदर्स, एक्चुअली हमारे ग्रैंड पेरेंट्स की जो जनरेशन है वहां पर 5 से 8 बच्चे, 9 बच्चे, 10 बच्चे नॉर्मल थे, राइट? Nobody had a problem of infertility. अभी क्या हो रहा है? मतलब it's become such a big issue. Why? Because we have created all these problems. PCOS, very very common. 1 out of 4 or 5 women in the reproductive age group are having PCOS, major cause of infertility, right? Ovaries ने काम करना बंद कर दिया because of various imbalances. इंसुलिन ज्यादा होने से, एस्ट्रोजन प्रोजेस्टेरोन का बैलेंस गड़बड़ होने से, डीएनए में डैमेज हो गया। Chronic stress, anyways, I've spoken about, right? That when you're stressed out, your body doesn't think that this is a time to create a baby, right? Dr. Ruhi, you wanted to add something here? Yes.
And again, you're struggling with infertility and you're trying to conceive, और आप सिर्फ अपना hormones ही check कर रहे हो, you're just checking your estrogen, progesterone, luteinizing hormone, आप ये 4-5 hormones ही measure कर रहे हो जो out of balance है, पता है out of balance है, तभी आप conceive नहीं कर पा रहे हो। So hormones out of balance किसी कारण से है, हमें hormones के beyond देखना पड़ेगा। Often एक पैरामीटर है AMH, anti-malarial hormone, जो चेक किया जाता है in case of infertility, कि कितना AMH है, and usually अगर वो low रहता है तो आपको बोला जाता है कि you need to go for IVF. So AMH is an indicator of how many it's basically it indicates the ovarian function. It does not say anything about whether you can conceive or not. वो indicate कर रहा है कि कितने आपके eggs अभी बचे हुए हैं, right? तो अब quality of eggs तो वो बता नहीं रहा है। अगर आप सिर्फ AMH measure करते जा रहे हो लेकिन focus ही नहीं कर रहे हो आप अपने body को nourish करने के लिए, अपने eggs को nourish करने के लिए, again सारे efforts useless हैं। And we see this so often that in infertility couples go for IVF and other techniques. So basically body को तो prepare किया ही नहीं गया to for fertility, to body को तो prepare किया ही नहीं गया to have the child, basically create an environment for the child in the body. टॉक्सिन्स को नहीं रिमूव किया गया, नरिशमेंट नहीं किया गया, एंड वही बॉडी को फिर आप फोर्सिबली एक कंसीव करने के लिए कोशिश कर रहे हो. रिजल्ट क्या हो रहे हैं? वी सी सो मेनी चिल्ड्रन टुडे विद वेरियस काइंड ऑफ डिसऑर्डर्स, ऑटोइम्यून कंडीशंस हुआ, ऑटिज्म हुआ, एंड इन मेजॉरिटी ऑफ द केसेस they are born through IVF. So it's very important that if you are planning to start a family, you first prepare your body. Naturally अपनी body को prepare करो so that it accepts the child that you are going to, that you want to have. That's very very important.
Correct. And I think just to add कि बहुत common है जब miscarriages.
Yeah.
आज की तारीख में miscarriage का मतलब क्या है? आपका शरीर क्या बोल रहा है? आपका शरीर सिर्फ ये बोल रहा है कि it is not ready for a child, right? Your body is telling you that it is not in a condition to handle, create a baby from scratch. And that is why miscarriages are happening at different stages. Body is not ready and mind is also not ready if you are stressed out and all, right? So, how many of you think you are relaxed right now? Can you put it in the chat? Because I want to show you, I will show you in the next 10 minutes that most of us were not relaxed. Okay. Harman, you don't have to be so sad. Don't worry. Most of people are saying, no, not relaxed. Okay. Good that you are realizing at least. Okay. Okay, wonderful. Thank you for replying. What we will do is we'll just take 5 minutes, okay? And we will use a very simple breathing technique to bring our mind, our brain, our nervous system, and therefore our body to a very, very deeply relaxed state. Okay? Very, very simple method. I'll stop the sharing. So what I need you to do is to sit comfortably. Okay, आप लोग जो खड़े हैं घूम रहे हैं वो बैठ जाएं आराम से, relaxed posture में, बैक को comfortable रखें लेकिन सीधा. Sit with a comfortably erect back.
Please switch on your videos if you can.
तो हम एक ब्रीदिंग करेंगे एक अलग तरीके से, बहुत ही सिंपल है, ठीक है? इसके लिए क्या करना है? इनहेलेशन नाक से, एक्सहेलेशन मुंह से. So you have to, don't start, just understand it first. You have to inhale normally through the nose and you have to exhale through the mouth. जब सांस मुंह से छोड़ेंगे उसको थोड़ा सा लंबा कर देना है. जो भी आपका नॉर्मल एक्सहेलेशन होता है उससे थोड़ा एक्स्ट्रा, थोड़ा मतलब 5%, 10% एक्स्ट्रा ओनली. और एक्सहेलेशन खत्म होने के बाद में हम वहां पे आधा सेकंड, 1 सेकंड के लिए रुकेंगे. ओके, एंड देन वी विल स्टार्ट इनहेलिंग अगेन. ये करते हुए हमें क्या ध्यान रखना है? हमें ये ध्यान रखना है कि हमें जो हम एक्सहेलेशन को लंबा कर रहे हैं, एक्सटेंड कर रहे हैं, वो बहुत ही रिलैक्स्ड कंडीशन में होना चाहिए. ऐसे हमें जबरदस्ती नहीं करना है उसको एक्सटेंड, क्योंकि आप जबरदस्ती एक्सटेंड करेंगे तो बॉडी में स्ट्रेस होना शुरू हो जाएगा. ओके, so extend your exhalation in a very gentle, relaxed manner, and also the pause at the end of the exhale should be very relaxed, very short and very relaxed. आप देखेंगे कि जैसे आपका रिलैक्सेशन बढ़ेगा ये करते हैं, आपका जो पॉज है वो अपने आप बढ़ना शुरू हो जाएगा. लेकिन अगर आप जबरदस्ती करेंगे तो उसका उल्टा असर होगा, आपके शरीर में और दिमाग में स्ट्रेस बढ़ने लगेगी. ओके, so please close your eyes, sit comfortably, inhale as usual through your nose, exhale through your mouth, lengthen it a little bit. मुंह से सांस छोड़ें, उसको थोड़ा सा लंबा कर दें. Linger after the exhale is complete and spend a moment in the pause before starting the next inhale. Exhalation के बाद में थोड़ा सा वहां पे रुकें, आधा 1 सेकेंड, और उसके बाद सांस लेना शुरू करें नाक से. आप देखेंगे कि इस बार इनहेलेशन थोड़ा सा लंबा होगा पिछली बार से, होने दें, जैसे भी शरीर करना चाहता है उसे करने दें, लेट इट बी नेचुरल. Exhale slowly and evenly through your mouth. Then it a little bit. Inhale through your nose, let it be natural, and exhale through the mouth. Keep your mouth relaxed, just leave a little gap between your lips. Continue to inhale through the nose and exhale through the mouth. Gently stretch the exhale a little bit, make it a little longer. And after the exhale, just stay in the pause for a second or two before starting the inhale. Continue to inhale through the nose and exhale through the mouth. You will see each time as you exhale, you will get into a more and more deeply relaxed state. This time as you exhale, imagine you are blowing air at the flame of a candle in front of you. Your intent is to touch the flame lightly, not blow it out. आप ऐसा इमेजिन करें कि सांस छोड़ते में आप के सामने एक कैंडल है, उस पर आप फूंक मार रहे हैं. आप ये करना चाहते हैं कि वो हवा आपकी मुंह की जो है वो थोड़ा सा हल्के से फ्लेम को छुए, बुझनी नहीं चाहिए. Stretch the exhale, but don't try too hard. Let the exhale be slightly longer than the last one. Inhale again through your nose for a duration that feels natural and relaxed. Now exhale even slower through your mouth. Let the exhale stretch to a point that is still comfortable. You should not try to stretch to a point where you become uncomfortable. That will create stress, not relaxation. Keep your eyes closed. Take your own time and very slowly open your eyes. कैसा लग रहा है? Any difference compared to how you were feeling 5 minutes back? जिन लोगों ने चैट में बोला था कि हाँ we are tensed up, can you please share? कुछ फर्क लग रहा है आपको? Feeling better? Nita is feeling better. Yes, Sonia is feeling good. Ashu is feeling calm. Harman, yes, good. Priyanka, yes, feeling good. Sushmita, you see the difference? Just a little 3-4 minutes of breathing we have done. और आपने पहली बार करी है, राइट? आपको एक्चुअली प्रैक्टिस नहीं है बिल्कुल भी इसकी, उसके बाद भी इतना फर्क है आपके शरीर में और नर्वस सिस्टम के एक्टिविटी में, ब्रेन के एक्टिविटी में. जन्मू आप जितना भी चाहें कर सकते हैं, 5 मिनट, 10 मिनट, आधा घंटा, दिन में जितनी भी बार आप करना चाहें कर सकते हैं. वेरी सिंपल बट अ वेरी वेरी पावरफुल system to stay in the parasympathetic mode of your nervous system in a relaxed state. Naturally your healing will start happening better, right? तो अब आप ये बताइए, अगर आपका सिस्टम relaxed hai, mind and body. Body is well fed, well nourished with good food, balanced food. You're rested, you're calm, and you're happy. You're well hydrated. Emotionally, you are open and receiving. Not angry, frustrated, and closed. Body में inflammation नहीं है. Does this equal to a happy and healthy and vibrant you? अगर ये सब होता है, will this mean that you are a happy and healthy person? Yes, isn't it? It's obvious. And in case, for those who want to conceive, do you think conceiving will happen much more easily when you are in that kind of a condition? Yes, again, isn't it? That's all there is to it, actually. The science of health, the technology of health is not difficult. Few fundamental things, few root causes, if you understand and start addressing, that's all it takes.
Yes. And so the most important thing is, if we want to fix the hormones, if we want to reverse autoimmune conditions, PCOS reverse karna hai, hypothyroid reverse karna hai, we have to make the mind and the body work together. We need to work on creating a healthy mind and a healthy body. हम सिर्फ सोचेंगे कि हाँ अच्छा खाकर और सारी problems ठीक हो जाए, नहीं होगी. We have to touch upon all the main components that's important to reverse a chronic condition. And that's the beauty of this program, the Happy Hormone Program, where we will be working on a 5-pillar approach. So we will be working on bringing right nutritional balance. So jo bhi aap kha rahe ho, it's only going to heal your body and it's not going to cause any further inflammation or any further damage to your body. Work on detoxification of your system so that if you have a healthy liver, if you have a healthy digestive system, your hormones will be in balance. You will be able to absorb food better. You will be able to nourish your body. Try every possible way to eliminate. एक तो toxins लेना कम है और एक अगर ले भी लिया है तो उसको body से निकालना बहुत जरूरी है. चौथा है come out of that state of chronic stress. Usually अब तो it's like stress is a part and parcel of your life, but you do not want it to affect your life. So it's very important that you work with right strategies so that you can handle stressful situations better and come out of that state of chronic stress and help your body be in a better metabolic condition, help your body work, create an environment that is conducive for reproduction. And lastly, we will be working on how you can connect with nature, how you can help nature help you in reversing chronic conditions. So in this program, so as I said, सिर्फ खाने पे focus करने से नहीं होगा या सिर्फ exercise या yoga करने से नहीं होगा. It has to be a holistic approach, and that is what we will be working on in this program. We will be working on moving away from disease management to actually help you reverse the condition. And in doing so, we need to understand what exactly is your body's situation at this moment, right? And this we do by understanding in detail about your history, about your signs and symptoms. We need specific parameters to be tested much deeper than the hormones itself. We are not going to test your hormones. हमें पता है hormones are out of balance. कुछ नहीं कर सकते आपका estrogen या progesterone जानकर क्या levels है. We need to understand your vitamins. We need to understand the minerals, the inflammatory markers, toxins कैसा कितने हैं, gut health कैसा है, so that when they are out of balance, we can work on that. So once we know all these details, then a very personalized plan is made, which actually would focus on nutrition. It would focus on lifestyle changes, on your sleep habits, on your mindful eating, working on the gut, working on the stomach health. All these things together with certain supplements, all these will be a part of your personalized treatment plan. And in addition to this, you will be taught a lot of stress management techniques so that you can come out of that chronic stress situation and activate your parasympathetic system. A lot of many times we see that there are certain traumatic situations in their life which are kind of stuck in your mind, and that is contributing to chronic conditions, that is contributing to your inability to conceive, or that is causing an autoimmune condition in you. So all these will be taken care, and there will be a lot of emotional cleansing techniques, purifying breath techniques that you will be taught. And another important component is the juice fasting, which again will help you in cellular detox. Apart from that, we will be working on how to connect with the mother nature. And all these will be done in a group way, and so that you see how the others are doing, you learn from them. We will be conducting live sessions to focus on each of the 5 pillars. When you understand them in detail, you are able to implement them and sustain them, rather than आपने कहीं से कुछ सुना किया, didn't work out, and then you are back to your old habits. So it's very important that you understand in detail about why each component is important, and we help you, handhold you in implementing it. So all this will be a part of the program, and Ayush will talk more in detail. A quick thing, आपको पता कैसे चलेगा कि आप ठीक हो रहे हो, आपकी बॉडी हील कर रही है, आपके एनर्जी लेवल्स इंप्रूव होने लगेंगे. Ashu had said that her energy levels are very low. She has autoimmune conditions. So Ashu, you will start seeing an improvement in your energy levels. Headaches, which are very common, वो हटने लगेंगे, frequency कम होने लगेगी. You will be sleeping better. Your periods will start becoming more regular. The flow will be better. आपकी skin quality improve होने लगेगी. These are signs that you're healing. You will feel much more connected with your body, rather than the current feeling कि आप अपने body को drag कर रहे हो. You will be in sync with your body. आपके cravings कम हो जाएंगे. After eating, you will feel happy, rather than you feeling drained out after having your meals. You will have better bowel movements, and your whole body will look much more toned, much more healthier, rather than puffy and inflamed. So these are some signs that you will know that will indicate that your body is healing. I'll hand over to Ayush to take this further. Ayush.
Yes, ma'am. So we'll talk about how the program is, but before that, I would like to get a few questions answered, possibly, because people have been waiting for a fairly long time. So my request to everyone is to please raise your hands. I'm going to unmute you. We'll talk about how the program is and the structure is and so on. But काफी लोग काफी समय से, and people have to leave as well. So let's get some questions answered. So please make sure that you are raising your hand. We have thrown out open a poll as well. एक छोटा सा poll है आप लोगों के लिए. अगर प्रोग्राम के बारे में आपके सवाल हो या आपका इंटरेस्ट हो, तो please share your phone number as well in the group chat, so that we can reach out to you in case your questions are not fully answered or whatever it is, and we can guide and answer to your queries accordingly. Yes, clarity on the program, which many of you have reported, so to speak. तो वो प्रोग्राम के बारे में तो हम बात करेंगे ही करेंगे. So that's not a concern. But despite, other than the program, please start raising your hands and posting your questions. So I'll just take a little bit of time, and I'll just play a small little video थोड़े समय के लिए, just to help you understand how people have gained some of the things.
10 years of weight gain, 10 years of pain. I have tried everything. Everything has given me a short-term result, and then I bounce back to the same, or I bounce back worse. But this time, 21.
I'll just quickly go through this video. Just idea is to help you understand the kind of conditions that it benefits in.
21 days or more, what I have done. That first 18 days was easy because eating millet, sugar, I have done it before. But then that altered the system dramatically. I didn't even imagine that a 3-day juice can do this to your life. Slowly now I have started fibers, and the craving for, the need for food itself has come back. I think I eat only one millet meal a day. I don't even eat 3 times. I go with a smoothie, 1 millet meal, and 1 salad bowl or a soup bowl. That's all I'm able to eat. That is fantastic. I lost 5 kg. I was I was spreading from double XL to triple XL in my, and if I strained too much, it was the feet pain. Small issues are there, but my major pain was the knee pain, which is gone. I thought that if I continue doing this, and I stopped it and I haven't started back, I checked and my BP is actually 118 by 80. So I don't think I need to go back to SC. The guidance is excellent and it's a great program.
I think periods were flow was much better than the last few months that I was suffering from low flow. This month it was good. I can see that. And I can only say because of the lack of sugar in my diet, which is completely eliminated. I have not even eaten fruits. I just wanted to see what it does to my body. So no sugar at all in any form. No honey. It has every time I get a cycle, it will break out like anything. This time it was like even one, and that too, it just went out. It didn't get formed. That is it. Energy levels are pretty high. And please just saying no. Yeah, so I just want to continue this. Go inside and change anything. Now in my hand, I feel that I can take.
And in fact, if you remember in the beginning, only that problem I had cited, that I am facing this low flow for last couple of years since my miscarriage. So I would say that over next couple of months. So I was really.
So there are several stories like this. So we'll share this video in detail with you. So I'll just open up for Q&A. You can unmute yourself. So we'll start with some of the questions which are there, ma'am. Rheumatoid arthritis. So, all right. So rheumatoid arthritis. I think there is a. Okay. Hello. I'll mute myself. You can probably read the question.
So Ashu is asking if there's an echo.
अगर सेम प्लेस पे दो लोग ऑन कर रहे हैं कोई होगा
Ayushi, you want to speak about the program details? Because questions will be difficult to take now.
Ayush, you are muted.
It's a 3-month program that we are talking about. So one part is personalized, and then there is a come out. So treatment, we take a detailed and all the tests and they also go in. Basis which we do a case analysis, and wherever we go for further testing. So blood sample is from your home. Basis that we do for analysis and out a plan of action. And a disciplinary call is explain about how the treatment would go about. Meanwhile, continuous support, and there are sessions. Ask me anything that do happen. WhatsApp support, and the doctor support, the separate dietitians, etc. is continuously made available. वो सारा कुछ आप continuously रहता है. Treatment is personalized. The group is supposed to implementation. So साथ में कुछ classes 5 sessions to happen. They're supposed to educate on different pillars. And meanwhile, there is a group so that in a group you can match each other, help each other successful in the program. Cost of the program for a 14,000 rupees. and 1 month if you want to try, it would be 8,000, and 8,000 and it would be 8,000 additional. Or else you can one go and get a 2,000 rupee discount. So the program would be starting on 3rd of September 7 p.m. All right, so I'll just stop the share. Hold on. So we can pick up a question. I understand. There is. We don't understand why it is that.
Priyanka, why don't you ask the question?
Yeah. Actually, I have hypothyroid. Can you listen me?
Yes.
I have hypothyroid, and I'm practicing Kumbhak for hypothyroid, but irregularly. And recently I've done my test, and my sugar levels, which are borderline, are now have shooted, and my HbA1c is 8.2, and my sugar levels post lunch are 300. So along with that, I have like other hormone problems like mood swings. I used to be PCOD, but now I am not. My ultrasound report is like normal. There are no cysts, anything, but I do have its symptoms. I have fatigue and all that. So my two concerns are hyperthyroidism, and I have been in medication for 5 years, but there's no improvement. My TSH is always 0, but my T3 and T4 are okay, borderline normal.
Okay. So
Yes.
Priyanka, cyst in the ovary is only a symptom of PCOS. It's not like because you have cyst, you will be diagnosed with PCOS.
Yeah.
Okay. So your ultrasound can be completely clear now. Your ultrasound can be completely clear, but still you're having the symptoms because it's just ultrasound can be completely clear.
Yeah.
Because the cyst is because of the hormonal imbalance.
Recording
because of the hormonal
Yeah.
imbalance.
Yeah.
Okay. So if you have to reverse your diabetes, your hypothyroid, your PCOS, we need to work on insulin resistance.
Yeah.
Right? And now you mentioned your
So
TSH is low. So it's also important to rule
it's
out
0.
autoimmunity.
So what should I be doing? Should I enroll for this program, or should I continue with my Kumbhak for the thyroid, which I've been doing from 2-3 months?
So you can definitely continue with the therapy that you have been doing, but then it's very important to work on other aspects as well. The 5 pillars that we spoke about during the session.
Yeah. So am I advised to enroll for the program?
It will definitely help you reverse the condition if you go through this program.
I can't hear properly. I'm sorry.
Is it better now?
Yeah. Can you please repeat again what you said last?
So Priyanka, it will definitely the program will definitely help you reverse the condition because we will be able to identify the root cause and work on it.
So do I need to practice the Kumbhak for thyroid also along with this?
If you want, you can continue practicing that as well.
Okay. Oh yeah, I'll talk to you in detail again. I can't hear properly.
Okay.
Yeah. Thank you.
All right. So there are a lot of people with questions. So people who have raised their hands, you can ask your questions, Ms. Pratibha. There are a lot of people with questions. So who have raised their hands, you can ask your questions, Ms. Pratibha, Ms. Poonam.
So Ashu, we won't be giving you any medications in the program. Ashu, we won't be giving. There would be certain supplements that would be recommended based on the need after we have evaluated. Certain supplements that would be recommended. So Fani, if you have a question, you can unmute yourself and ask. Please try now. You should be able to unmute yourself.
Yeah, my name is Fani and I am at 95 kgs. I have PCOS for the last 18 years and because of a laparoscopy around 10 years back, I developed umbilical hernia, which I got operated just a week back. And along with that, I also got some of my ovarian cysts ruptured. So with this condition now in the post-operative stage, I want to use this period when, you know, for next 2-3 months, I won't be allowed to do any exercise. And of course, not in the area of the stomach where I had fat. But the only thing the doctor said is that when he operated, he saw a lot of visceral fat around the liver and the ovaries. So he said that, you know, you must start doing something about it. So my question is that in this post-operative period with this hernia thing just operated, how much can I use what you are suggesting, the 5 pillars, to you know, use it positively to reduce my weight from 95 kgs and even without stressing the stomach area, see changes in my weight
Absolutely. So
and hormones. Yeah.
yeah. So Fani, now you see that, you know, 10 years ago, the surgery that you underwent, right? Which again, I understand that was also to remove the cyst, right?
Yeah, to rupture
Yeah.
the watery cysts,
Right.
to conceive. Yeah.
Yes. Yeah. So there again, an attempt was made to remove something that was, you know, kind of creating trouble, right? So that was removed, but nothing was done to stop new cysts from coming, right? So we threw out something that was not fit into the body, but then nothing was done to really prevent new cysts to be formed, right? So the problem continued, the root causes continued, and
Yes.
again, you know, the hernia that you develop, right, that again is, it's not just because of the surgery alone, but a lot of other contributing factors, right? Chronic gut issues of also lead to is also one contributing cause of hernia. So now that you have underwent another surgery, right, and the post-operative period, of course you can use it very positively, and not only to reduce you know, the unhealthy weight gain, but also to reverse the condition, right? And especially now in the post-operative situation condition, your body needs a much healthier lifestyle, right, so that you heal faster.
Yes.
Right? So in our program, we do not stress on exercises a lot. We focus exercise again when there's already high inflammation in the body. Too much exercise is going to be unproductive, okay, and actually counterproductive. Okay, so it's very important to focus on right things that you feed your body with. Okay, enable your body to process that food better. Okay, work on various organs in your body so that you know the detoxifications also happens. The detoxification happens, and you're able to eliminate the toxins in your body. Okay,
Okay.
work on balancing your stress levels, and of course, take more sun, do more grounding, reduce the impact of artificial lights around us, artificial radiations, and all these will together help you in your healing journey.
I see. Okay. Right. What did you say? Grounding of what?
So grounding basically means connecting to the earth.
Okay. Okay. So avoiding blue toxicity and
Absolutely.
exposing myself to the sunlight, and like you said, eating the right things,
Yes.
and basically using this period to lose weight by eating the right things.
Yes, and not just eating the right thing, but also work on other components, right? Work on a holistic approach, right? And again, also identify what is contributing to the health problem, identify the root cause, and then work on it with the right strategies.
Okay, right. So in these 5 pillars, will any, because I don't think I can do Kumbhak therapy, right?
I'm not the right person to guide you on that. I'm not a Kumbhak expert.
Okay.
Yeah.
Fine. All right. Thank you.
Okay. So Ashu, yes, Hashimoto can be reversed. Hashimoto, or be it any autoimmune condition, when we work on why there is autoimmunity in a person's body, when we work on those factors, autoimmune conditions can be reversed. Others have questions, please unmute yourself and ask.
Finally, so Ms. Jangmu, Ms. Poonam, Padma Vibha, funny, you have asked your question. So Ms. Padma Vibha, Jangmu, and Poonam, if you're there, please ask your question. Ma'am, there was a question on pelvic inflammatory disease.
Yes, yeah. So is the person here who had asked that question?
Yeah.
Okay. So
Everyone can unmute themselves. You can unmute yourself now and ask your question, please.
Yeah, good evening, sir, and good evening, Dr. Ruhi. So, Dr. Ruhi, I have a quick question with you regarding, premature of the gray hair, because this is the only one problem which I'm suffering from. And my second question would be, you talk about the toxin, deposit in our body and the uses of the sunscreen. So could you please advise us, what kind of sunscreen to go for? Because, sunscreen is very necessary for us, and without applying also, our skin tends to get very dry. And so it will be very helpful if you can advise us what kind of sunscreen we can go for.
Okay.
Thank you
All
so
right.
much.
So first, regarding premature graying out the hair, so it's related a lot to the nutrition deficiencies, right? Especially zinc. So those have to be, so you should get yourself tested for these, and based on what you're deficient on, should work on correcting them. Second, gut health plays a very important role in that as well. So you might be taking all healthy foods, but then it's not becoming a part of your body. So that's where the gut health needs to be looked into. And if you are low on healthy gut microbiome, if you're low on digestive enzyme, they need to be identified and addressed. Third, your question on the sun blocks, right? Now, if you are going out, sun is very important for us. There is just no alternate to, a sun. It's important for vitamin D synthesis. It's important to recharge your mitochondria, which is the powerhouse of the cell. So if you are going out in the sun and applying a sunblock, you are basically not absorbing any sun. So that's equal to, you know, kind of, if you're really going out in the sun to take out to get the benefit of the sun, you're just not allowing that to happen by applying a sunblock. So sunblock is actually detrimental to your body.
So, ma'am, Miss Fani has further asked a question. You said the condition of new cyst formation cannot be reversed.
No,
So
I didn't
how-
say that it cannot be reversed. What I said that by just doing a surgery, no effort was made on reversing the formation of new cyst.
Right. Miss Padma Vibha and Miss Poonam, you can unmute and ask your question, please. And others also, you can unmute and ask your questions.
No, ma'am, I just meant to say that the new cyst will not be reversed, but now that hernia is not an obstruction for, weak stomach muscles, now what all can I start doing to reverse my PCOS?
So funny, as I mentioned, we work on all the 5 pillars, right, during the program, and that based on what the root cause is in your case, which we will identify after thorough history taking and after getting the required test done. So based on that, the root cause analysis will be done and the further action plan will be advised.
Okay. And I can do this after how many months?
You don't have to wait for anything. You don't really have to wait for, you know, your post-surgery period to be over and then get started with it.
Okay, thank you. Yeah.
In fact, it will help you recover faster from the surgery also.
Yes.
I see. Okay.
Uh,
I'll
so
give it a thought.
Miss Padma Vibha, Miss Poonam, you're there. You can ask your questions, please.
Dr. Rohit, Padma here. Actually, I had one question related to if we enroll for this program. So will this be like if you are suffering from hypothyroid and PCOS for many years, maybe more than 10 years, in that case, whether it will get reversed in 3 months or is it that it is going to take a couple of years, and how this program will help us across the journey, or it will be only for 3 months and then we have to keep on repeating till the diseases get reversed? How is it going to be?
So it doesn't matter whether you know, it's you've had it for 10 years or you've had it for 2 years, right? So the timeline is somewhere between, for some people it might take 6 to 9 months, while for some it might take a year to reverse the condition. In 3 months, you will start seeing your health moving towards the right direction, towards a positive direction. You will start seeing your health getting better, the signs of healing that we showed, right? You will start seeing all those changes in your body. And that's the indication that, you know, you have started on the journey of reversal. So in 3 months, yeah.
I'm just saying that also important thing is that in those 3 months, you would have understood what changes you need to make or you have made already, right? So it would have become part and parcel of your day-to-day life at the end of 3 months, so that even when the program is over, you can continue walking on that path of improvement. So your improvement does not end with the program ending. That's the important thing I want to convey.
Yeah, absolutely.
Just to further add to both Dr. Rui and Mr. Siddharth is just that you get all the tools to become your own doctor.
Absolutely.
So you basically know how to heal yourself. You don't have to join the program again. You don't have to do the whole cycle again and again and again and again. None of that is required. The idea is to help you get coached into the right methodologies and framework and structure to, you know, how to progressively be on a path of complete healing. So none of this needs to get repeated. So I hope that answers. Miss Poonam, you wanted to ask? Great. So I'll try and pick a few questions from the chat. Okay. So it would be difficult. So I'll just talk about how the program is again, because it was too much of echo at that point. So the program structure is basically divided into 2 components. One is about treatment, wherein that is completely personalized. So one part is treatment. how do you treat yourself, all the problems that you have, what is the progressive path towards healing, and continuously remaining in touch with your experts and the dietitian support, which is separate, all of that, वो continuously आपका separately, individually चलता रहता है. Then there is a community-based support, which is helping you implement on a day-to-day basis. So all the queries that you are having, you would be asking in the group so that you can get a timely response, not just from the expert, but also from the people who are participating. So specifically speaking, step one, we fill in a detailed health history form. So right from the beginning till now, all the tests and reports, everything goes in. Basis that, experts do a case analysis and advise you on some blood tests, of which you can either do it on your own or you can take our help and get it done from our support. Basis that, we draw out a plan of action and through a root cause analysis, draw a plan of action and get into an explanatory call to explain to you कि क्या issues निकले हैं 10, 12, 15 for your condition and how do you come out of it. Basis that, we start our treatment. Now in terms of implementation, continuous tracking and support exists, and वो WhatsApp group के through भी और individually भी आपके लिए support रहता है. Now there are bunch of sessions which happen, monthly sessions, they happen in month 2 and 3, and there are 5 sessions which happen in month 1 to help you implement in the right manner. Now you also do get health buddies, program के और participants जो कि आपके जैसे परेशानियों में हैं, you get a buddy system to get the motivation up so that you continuously keep doing it. वो knowledge sharing sessions होते हैं, बहुत सारी आपको recipes दी जाती हैं और बहुत सारा और advisory दिया जाता है in terms of your specific individual situation and condition, वो सारी चीजें रहती हैं. Cost of the program is 14,000 for 3 months. If you break it into 2 components, first month is 8,000, next 2 months are 8,000 also. That's how the entire thing is. The program is starting from 3rd of September. So that's what I wanted to share about the program. Right, you can reach out to us. The phone number has been shared. You can reach out to us directly on that phone number as well. Meanwhile, you can throw a note in the group. आप WhatsApp group में रहे होंगे, नहीं हैं तो please do join that particular WhatsApp group. And there are a lot of people who have asked about clarity of the program. I hope those who have remained, they have had an understanding of how the program works. आप लोगों का और कोई सवाल है तो please unmute yourself and ask your question.
Dr. Ruhi, there was a question on menopause also, if you can cover that. Okay. So usually we see, these days we see that, around menopause, again, the women experience a lot of hot flashes and a lot of other discomfort during that period. So naturally, the entire, arrival of menopause should also be very convenient without such symptoms. But what we see that because of the kind of lifestyle we have had, right? So usually there is insulin resistance during that period as well, right? There are other imbalances, when women is around 50 years of age. So again, the approach would be to identify them, right? Identify the kind of inflammation that's there, insulin resistance, imbalances, any heavy metals, and identify those and then work on them. So the only point is it's a factor of certain imbalances. Not everyone is having symptoms when they're going through their menopause. Yes. So there are certain things which are causing that situation. So that needs to be understood and corrected.
Same thing is actually applicable to, pregnancy. A lot of women experience starting of chronic ailments like thyroid, diabetes, etc. after pregnancy. It's the same thing that the body wasn't ready to handle the strain of the pregnancy. It can be worked upon.
Right. So with that, any other questions? We would love to answer that. Otherwise, you have the phone number. You can always get in touch with us. If you have any queries or any interest or anything, you can drop us a note in your respective groups, or you can contact us directly on the phone number which has been shared with you, or you can leave your phone number so that we can reach out to you. Please make sure that you have responded to the polls, and we'd love to welcome you and see you in the program batch, which is starting on 3rd. Good luck to you guys.
Thank you, everyone.
Good night. Namaskaram.
Good night.
Namaskar.